Y'all got questions? Y'all big is not as big as mine. So open it away from you. 2-inch. 2-inch. All right. Now, once I put these gloves on, it's over. All right. All right, so I'm gonna put the gloves on. So I'm still preparing my field, right? All right. So you can either use the bedside table or you can use this. I like the fact that I'm using this, but whatever. All right. So you're gonna open this kit up on the bed, not the bed table, because we be turning and stuff like that. All right. Let's take these off because they're gonna cause me problems. All right. So we still preparing. Get it on. This is where I said you can bring your gloves that you did sterile gloves with. You can do that and repackage them in this kit if you want to. All right. Here we go with this whole thing. Boo. All right. I don't need it right now. It is what it is. So if that happens, don't worry about it. All right, so what's next? So I'm still preparing. So shiny side down, you see the shiny side versus, you see how this is dull and this is, so shiny side down. All right. That's all you need to do. We're not tucking, we're not doing nothing else. All right. All right. Still preparing. Fenerated drape, it's got a hole in it, right? We just wanted to go over the penis or the vaginal area. Just put it down. Keep your hands above your waist. We good. All right. See, I don't need. Now move this tray closer and put it on your sterile field, right? We're all on sterile, right? We're all sterile. It's our sterile field right here. All right. We're still preparing. Open up your swabs. Okay. I have these on here. These are the betadine ones. I'm not gonna open those. Okay, so I'm gonna use these. So open your swabs up, and you actually can, if it makes it easier for you, put them on your tray, because they're sterile. Slide them right there, and then don't go across your. If you go like this, you contaminate because you're going across the field. Go like this and just drop it in the garbage. Don't worry about if it hit the garbage, good. If it don't worry about it. All right. Let's see. I need these. All right, so I need my jelly. Actually like this here. So sterile still touching sterile, right? All right. Our sterile gloves is touching the sterile tray with our sterile things. There. All right. Now I have to connect this to the. So this is still sterile. Oh, this is sterile. So the catheter doesn't flop around when I take the sheath off. I'll run my hand up with it. I don't want it to flop around. And then I'm gonna put it in the lube. And let's stay there real pretty. All right, so this I don't need. So I'm gonna come around and drop it over there. All right. This, still preparing, needs to connect to here. This is the balloon. Push and twist. All right.
What liquid is already in there? What is that?
Saline.
Saline. Okay.
So, all right, I think I contaminate because didn't my arm hit that? All right, so just be careful that your arm doesn't hit anything and that everything stays on the sterile fill. All right, we good? All right, keep your hands up. Now, once you touch, you cannot, this hand cannot leave the, because now you're finna contaminate because you're touching the skin of the penis or the vaginal area. All right, so make sure all right, so you want to grab the penis and hold it up, all right, like this, and then swab around one, throw it in the garbage, swab around a little further, throw it in the garbage, and then swab across, throw it in the garbage. All right, keeping your hand here, you want to lube it up real nice for the men. All right, how many inches am I supposed to go in?
2. 1 to 2.
What does it say? Read it for me.
It says advanced catheter approximately 1 to 2 inches after urine appears in the tubing.
Right, so listen to what it said, 1 to 2 inches after. So I'm going to put this in as far as I can till I see urine. This is the part. All right. So for a man, this catheter needs to go through the shaft of the penis into the bladder. So I'm going to put it in about 5 inches. Now I see urine. Now the 1 to 2 comes. So I'm gonna go 1 to 2 more inches for the male. See how far up this is? Because it's got to go all the way into the bladder and the shaft. So we got to go past the shaft. So to be honest, for the male, you're almost at the, so about, we can say, think about 5 inches first and then 2 more, 1 to 2 more, all right? So now you hold this here, because if they cough, the catheter is gonna go whoop right out. Or if they sneeze or something, so hold on to it, because we don't want to do this again, and I'm sure he don't want you to do it again either. And then inflate your balloon. Okay.
Is this painful for them?
It's uncomfortable because the bladder feels kind of full because now you got this in there. Hold this in, let go, twist off, all right, and throw it away, all right? Now what they want me to do? Just say tug.
Gently pull back on the catheter until resistance is
Okay,
felt.
so gently pull back, just a little bit. So it's in place, so you know the balloon is in place, all right? Then what?
Using tape, anchor catheter tubing.
Okay, so make sure that we give you tape before you start. Otherwise you can say, now I'm gonna tape this to the anterior portion of the male's thigh, okay? For the female, it goes to the inner thigh, okay? On the male, it goes on top. Make sure you have slack, because you don't want this like this. See how it's pulling? You want slack. So you want anterior portion of the thigh. All right, we're gonna take that, and then we're going to take our bag. So when you're testing, do all of this. Say, I'm gonna tape it to the anterior portion of the male's thigh. Hopefully we'll give you tape, but if we don't, that's okay. Just state it. And then I'm gonna put my drainage bag down here on a portion of this bed that does not move, which is that portion right there. You guys see those bars on the side? That's where you put it. All right. When you're saying that you're pushing it in and saying about those 5 inches, say I see urine, you can say I see urine, because you know you went that 5 inches, and then put it in 2 more. That's fine. And then what do I do now?
Disposed of, use supplies and soiled gloves.
All right, so dispose of everything that you can. You can't dispose of this because then you would have to tear it. So we're gonna leave this. I guess we're doing anterior thigh over here since I put it on this side. Take away everything you can. All right, and then after that, just throw it right here for now. It's like, so you dispose of everything that you can. Put the patient back together. Leave that like that. All good. Cover your patient all the way up. Sorry, sir. All right, sir, we're all done. Do you have any questions? The doctor is coming in to see you shortly, so you can talk to your patient in real life, for real. But just let them know you're done, and then put the bed back down. So cover them up with that ventilator in place. Just remove what you can. Put the bed down. Provide the car light. Now you're done with your test. All right. And the reason that you're doing that is because this kit has to be repackaged even after the test, because you might need to use it in track number 2 or 3, okay, to do the demonstration of it or put a catheter in. So we're not gonna tear anything. So then after they say you guys are done with the test, now you need parts of your, you need this back. What you do is to get your kit stuff back together, push and twist, and it should refill itself. Okay. If it doesn't, then you can just pull the plunger back. You need to get as much fluid out of the balloon as you put in. That's expected. That's why you have to document that you gave a 14 French. You inserted a 14 French catheter under sterile technique with a 10 cc balloon. Okay, so, and then you put your kit back together. And then gently pull. Sorry, sir. Ooh, that stings. All right, and then now this can all come off. So then repackage your kit with all your stuff in it.
When you throw everything out, do you take off your gloves then?
Yeah,